Yeah, I now request Rabecca Kayumba to present on the topic exploring perceived food taboos during pregnancy and their relation to maternal, nutritional and health. A case of pregnant women in Namwala district, Zambia. Over to you, Rabecca.
Thank you so much. Greetings to all the panelists and presenters and all those in attendance. My name is Rabecca Kayumba. I'm a Zambian and presenting from Zambia, Lusaka. My topic, exploring perceived food taboos during pregnancy and their relation to maternal nutrition and health, a case of pregnant women in Namwala district, Zambia. Food taboos are foods and beverages that people avoid eating for religious, cultural, or sanitary reasons. Pregnancy, as we are all aware, requires a healthy diet. However, food taboos have influence on pregnant women, and this practice has been there for many generations, and breaking them is believed to harm the unborn baby or the mother's health. So observance of these food taboos are as a result of prior knowledge of pregnant women or what they are able to see from other women. And for others, it is because they want to show respect for the elders. Then food taboos may also influence women to disrespect healthcare practitioners' recommendations or advice, which can also lead to maternal and fetal malnutrition and worse preterm births. The study's literature was based on the conceptual framework, which has been illustrated below. So food taboos embraced during pregnancy, the dietary patterns that women embraced, and then the nutritional and health challenges related to dietary taboos during pregnancy. All these three factors can lead to maternal, can affect maternal nutrition and health. Rationale and need for the study. The health beliefs and food taboos are or negatively to maternal outcomes. So the study would help the traditional leaders in that area, maternal caregivers, and the community at large to embrace food and nutrition knowledge, which is ideal for pregnant and lactating mothers. The study would also help workers to identify the areas of concentration during antenatal health education. The study would also contribute towards the improvement of the nutrition knowledge and practices of pregnant women, more especially in rural areas like Namwala. The study would also provide a basis for policy formulation to develop cultural appropriate nutrition counseling education programs for pregnant women, therefore reducing incidences of low pregnancy, weight gain, preterm births, maternal morbidity, and mortality rates. The research objectives and questions: to investigate food taboos embraced during pregnancy, to identify dietary patterns that were embraced by women in Namwala district, to highlight nutritional challenges related to dietary taboos during pregnancy. And the questions were in line with the objectives as follows: what food taboos were embraced during pregnancy in Namwala district? What were the dietary patterns that were embraced by women in Namwala district? And what nutritional challenges were related to dietary taboos during pregnancy? The research design was descriptive, and we used both qualitative and quantitative methods. The estimated attended and received antenatal service 100 women were captured during the period of our study through purpose sampling. Therefore, this study consisted of 74 pregnant women. Purposeful sampling was employed in this study, as I've mentioned, targeting pregnant women who visited the antenatal clinics. Questionnaires and interviews schedules were used, and the statistical package for social sciences SPSS version 25 was used to analyze the data descriptively. Microsoft Excel sheets were used for the coding of data and the interpretations. Here are the samples of the research findings in this table form. So we have the first column where we see column where we're showing the reasons for avoidance. So we have butternut, mango, pawpaw, orange, pumpkin there, where the reason for avoidance was that the baby will have jaundice. The baby will lose hair, the baby's face will be dark, and other dark spots, according to ancestors. Then we have chili there, where the baby will have burnt skin or dark marks. And for some, they said it could cause diarrhea and that the baby would cry too much. Then we have the eggs there, the liver, polony, which is the processed meat, where the baby would have no hair. And then for the polony and the liver, it could even cause jaundice. The sweets, sugar cane, sweet food, honey, there we saw that the women said the baby would draw after birth and would even develop eczema. And then for alcohol, the baby would be born disabled and could even have brain damage. And the baby would even be born, would become a drunkard later in life. And then for the green leafy vegetables, we found that the women believe that the baby would have too much saliva, especially if gravy is too much in the vegetables. Then MAVIC, the baby would vomit and have heartburn after birth, and the baby would have too much diet. The baby would be lazy, and for the cold food, drinks and ice, the baby would develop pneumonia and cause kidney problems, and the baby would have skin problems and underweight. For the Coke, soft drinks, fizzy drinks, the baby would, the skin of the baby would burn, the reduction of milk production, asthma, acid would burn the baby, and also high blood pressure to the mother. The caffeinated energy drinks, coffee would even lead to abortion or miscarriage and would also increase blood pressure of the mother. The lemon, the baby would be small. The red meat, the baby would have gout, allergies, cause skin irritation. Then bird meat, baby would be very small and would talk too much, and the mother will have low supply of milk. Too much fat, the mother would develop high blood pressure. It would increase heart rate. Baby would be too fat. It would cause heart disease to the baby. For the groundnuts, the baby will come out with white stuff on the head and would vomit a lot. Sour fruits, the baby will have malnutrition and will be skinny. And for the salt, it would cause high blood pressure. For the beans, the mother would experience heartburn. Potatoes, it would increase the baby's weight, making it hard to deliver. Pineapples would cause miscarriage, especially in early pregnancy. Rabbit meat, baby's eyes would always open and blink less. The mice, not healthy food because of microorganisms and has no support from ancestors. the rice, there would be no growth value for the baby, and drinking too much water, baby's joints would be weak. Bone marrow in bones, baby will have runny nose, grasshopper and other insects, baby will have a long head, baby can have rashes, not allowed by ancestors. The chicken feet, baby will have 6 fingers. And this drew my attention because my firstborn child, a girl, had a 6th finger. So for those women, it is because of eating the chicken feet. For the sample, that is the crushed white maize, the baby will be skinny. Tomatoes, it would cause heartburn to the mother. And then meat prepared for ceremonies, especially in African societies, was considered unhealthy for the pregnant woman because of several people participating in the eating with different motives and backgrounds. Very interesting. Then too many fruits in general would cause excess body weight on the baby. Then reasons for avoiding too much fatty foods and the effect on the pregnancy. This was interesting because we took the statistics according to the responses from respondents, and what we found was the reasons for avoiding too much fatty foods and the effect on pregnant women was as follows. So those that believe that it would affect the skin of the unborn baby, the number was 15, translated into 19%. Those that believe that the baby would be born with no hair were 4, translated to 6%. Baby would have jaundice, 3, translated to 4%. Fat baby and contributing to prolonged labor and difficulty in delivering, we had 44, translated to 60%. Pregnancy, illness, nausea and vomiting, abdominal pain, headache and fever, 8, translated to 11%, and the total 74, of course, and 100%. And then for those that avoided alcohol and caffeinated drinks, which was good, we saw that the baby will be drunk, 27%. And then for caffeinated drinks, causes abortion or miscarriage, 20%. For alcohol, baby will be disabled. Let me finish with alcohol. Baby will be disabled was 13%. Baby will be sickly, 16%. Baby will have brain damage, 9%. Baby will be slow in thinking and drowsy at birth, 35%. And then on the caffeinated drinks, causes abortion, 20%. Burns baby skin, 14%. Acid will harm the baby. Baby will be unhealthy, 19%. Increases blood pressure, 27%. And reduction of milk, 20%. Then the reason for adhering to food taboos, 20% showed that the reason was because of attitude and beliefs. For culture, it was 50%, and for social, it was 30%. So it was concluded that the leading factor for adherence to food taboos was culture. The findings. Among the respondents, 59% had up to primary level of education, and 14% did not have any form of education, thus not able to analyze the effect of food taboos in relation to maternal nutrition and health. The women on this sample in Namwala district were either unemployed or in self and sustaining employment with little or no source of income to provide alternative foods from perceived food taboos. Namwala district, we observed that had a variety of food that were considered taboo when consumed by a pregnant woman. And the reasons for adherence to food taboos by pregnant women were many, with culture being the leading factor, as we have seen. The health benefits for avoiding foods like caffeinated drinks, alcohol, and too much fatty foods were not evidence-based in relation to science or research, but was just merely social and culture, meaning that the people there could make adjustments to their beliefs if proper mechanisms of communications are put in place. Adherence to food taboos was based on the fact that the unborn child was the unborn child especially would be affected, and in few instances the mother as well. Recommendations. So we recommend that a team of community caregivers, which should include traditional leaders who are the custodians of culture, would break the barrier of food taboos and help the women improve their maternal health. And then we also recommended that there's need to conduct dramatized community education campaigns to pregnant women and sensitize them on the importance of adhering to maternal nutrition and health. And then there's need to develop and promote maternal nutrition education and awareness programs in the school curriculum in order to discourage people from observing these detrimental food taboos. Then antenatal clinics should include a health feeding program like SHIN in schools, where women can be taught how to prepare nutritious foods, and even go away before going away could be given some nutrition snacks. Nutrition snacks, yes. Thank you so much for listening.
Thank you, Rebecca, for the wonderful presentation. Now we move on to the Q&A. Participants can post your questions through the chat box, or you can raise your hand so that we allow you to ask your questions. Phil Matthews, you can unmute yourself and speak.
Okay, thank you. I don't know whether you're getting me, the moderator.
Yes, Phil, you can continue. Yeah.
Thank you so much. Madam Kayumba, good afternoon.
Good afternoon.
Thank you. I was actually saying the topic is addressing the current issues that we have with our women, maternal health and care in Zambia. Now, I wanted Madam Kayumba, possibly, maybe because I didn't get it, to briefly give us an overview of the prevalence of food taboos regarding maternal nutrition and health in Namwala. Is it so prevalent or it's not prevalent? And if it's prevalent, among many other factors she has mentioned, what is it that she feels at the end of the day should help or should put in place in addressing such? Thank you.
Yes, so we see that the women of Namwala adhered to the food taboos because of the cultural factor, and the prevalence was high. And so from this study, we recommended that the women of Namwala could be assisted through the health facilities where they go. They could be assisted through helping them to prepare nutritious meals, and also to be given an opportunity to have a nutritious snack. Just like it happens in schools in Zambia where SHIN has been implemented. So from there, the women would be encouraged to eat nutritious foods. And further, we saw that the traditional leaders also could be engaged so that they can help in breaking the beliefs and food taboos, because abstaining or refusing to eat nutritious meals could actually lead them to having preterm babies. Thank you.